Hello and welcome back. So today I want us to discuss a very important topic that is that many people have requested me to look into it. That is uterine fibroids, or what we call leiomyomas or myomas. Okay. Now, if you're new here, please consider subscribing to our YouTube channel, that is Doctor on Wheels. But also, you can also follow me at a personal level at Dr. Itsuma on TikTok. But also, um, you can follow us as well for the sponsors of these videos, that is our Premier Hospital _ Gong for our Instagram, and Zawadi Premier Hospital Gong for our Facebook page. But before we dive into today's topic, let us listen to some words of wisdom from the book of John, chapter 3, verse 17. And let's hear these words of wisdom. So the Bible says, "For God did not send his Son into the world to condemn the world, but in order that the world might be saved through him." So let's dive into today's topic. So what is uterine fibroids? Or in layman's language, what are fibroids? So fibroids, okay, they are benign, what we call benign smooth muscle tumors. So benign means they are not cancerous, they don't spread from one place to another, and therefore when they grow, they just grow and they are localized in one area. So they are masses, okay, abnormal masses that basically grow in the uterus, okay. And most of the time they are what we call the most common masses or pelvic masses that you will find, especially in our women, especially during their reproductive age. And then the other thing that we need to understand is that they are hormone dependent. So which means their growth basically is influenced by the hormones that we produce, okay, so that ladies produce mostly estrogen and progesterone. That's why they will basically grow very big during the time when you're giving birth. Postmenopausal, because the hormone have gone down, okay, estrogen and progesterone have gone down significantly, they tend to shrink or they tend to stop growing, okay. Something as well to note is that it affects around 20 to 40% of women in their reproductive age. So it means if you have around um, 10 women who are in their reproductive age, okay, around 4 of them might end up having uterine fibroids. So basically it is that common, okay. And then the age limit is between 30 to 50, because past 50 they are postmenopausal. So most of the time, because the hormones will have reduced, so basically you will end up with reduced episodes of leiomyomas during that period. So between 30 years to around 50 years. Now, research has also shown that leiomyomas are more common, especially in women of the African descent. So, the reason not very clear, but then it is more common in women from African descent than other races. And then also it has been identified that it has family history. So if you have had any of your family members who had fibroids, okay, it's most likely that you might also be able to get those fibroids, okay. And then the other risk factors is nulliparity. So nulliparity is basically when you do not get pregnant as early as possible, okay. So basically you have not given birth, in short, okay. So during my med school, okay, we lecturer used to tell us that the uterus is supposed to carry something at any given point in time, okay. The uterus is designed to carry something, okay. So if the uterus during the reproductive age, if the uterus is not carrying a baby, okay, and it stays for long without carrying a baby, it will carry something else, and most of the time it will carry a myoma, okay. Therefore, very important to me to be able to understand that. And then research has also shown that also uterine fibroids are more common in people who basically end up getting their menses much more earlier. So early menarche. So if you start getting your menses probably at the age of 9 or 10 or 11, okay, so basically you might probably are at a higher risk of developing uterine fibroids, and also people who basically take a lot of red meat. Okay, and then what are some of the protective mechanisms? So people who are at less risk of developing uterine fibroids, number one are those people who give birth almost every year or multiparous people. Okay, so if you have been giving birth most of the time, okay, so the chances of you getting uterine fibroids reduces significantly. And then there are those people who use oral contraceptive as well. Okay, and then late menarche. So basically, when you start your menstruation a little bit late, from 16, 17, 18 years thereabout, therefore, research has shown that your risk of developing uterine fibroids reduces significantly. Okay, so what are some of the types of fibroids that are you can find in the uterus? So number one is the intramural. Okay, so intramurals, these are fibroids that are in between the muscles. So you see, the uterus has the inner lining, what we call the endometrium, and then we have and the endometrium is the one that basically gets the functional part of the endometrium is the one that gets shed off, okay, during menses. And then after the endometrium, you have the myometrium, which is the muscle part, okay, of the uterus, and then the outer layer is the perimetrium. Okay, so these intramurals, they are actually intertwined in the muscle part of the uterus. So that is number one. Number two is the submucosal. So submucosal, basically they will project in the uterine cavity, and they are associated with excessive or abnormal bleeding and infertility. Okay, and by far these are the most common, the submucosal. Okay, and then we have the subserosal. Okay, so the subserosal basically are they project outwards towards the peritoneal cavity. So basically they will be more of outside. So perimetrium, okay, outside the cervix. And then we have the cervical. So cervical can be around fibroids that basically develop around the cervical region, okay. But research has shown that especially the cervical ones are very, very rare to be able to come through. So how do patients present? So number one is that they will have irregular or symptomatic menstruation. So they will have heavy, irregular, prolonged menstruation. So prolonged menstruation, which is very irregular, okay, and you can actually have intermenstrual bleeding as well. The second thing is that when these fibroids grow to become very big, okay, they can compress or they can press on the adjacent structures, okay, and therefore they can cause what we call pressure symptoms. Now, we said that if this is the bladder, the uterus basically lies on top of it like this. So what happens if you're having masses that are growing in the uterus? They can compress on the bladder. When they compress on the bladder, your bladder will not be able to expand, and you basically you will have increased urine frequency. So you go to the urinate almost every now and then. Oh, and then the other thing is urgency. Sometimes you want to urinate, okay, and as you go, basically the urine comes out. You're not able to hold it enough for you to get to the toilet. And then retention, whereby it occludes the outlet of the urine. So basically you end up having retention of the urine. Now, if these masses basically compresses the rectum, okay, you will end up with constipation and tenesmus. So tenesmus is that feeling of itchiness around the anal region, okay. And then the other thing is that if these masses, these myomas, okay, or these fibroids, basically they grow near where the fallopian tubes are, okay, so on the left and on the right, they can actually block those fallopian tubes, and you can actually develop what we call infertility. Okay, if they grow in the endometrium, okay, like the submucosal, they can actually cause recurrent miscarriages, okay, and as well as preterm labor. So other symptoms basically will include abdominal or bulgy or enlarged abdomen. So basically you'll have some abdominal masses, okay, that sometimes might be very painful as well. Okay, now you can have as well these masses or fibroids that are pedunculated, okay, and if they are pedunculated, they can easily twist, what we call torsion. So when you have they twist and they twist, they can really cause what we call acute pelvic pain. Okay, so those are some of the things that you need to be aware about. Okay, so what are some of the complications? Complication number one we have talked about is when you start bleeding a lot, when there's a lot of bleeding, okay, you can lose a lot of blood and therefore you can become anemic. And we are going to have a deep discussion about anemia because anemia is a big topic, okay, because anemia can even cause heart failure. Anemia can cause even a lot of things, okay, so anemia, okay, dizziness, headaches, okay, blurring of vision and all that. The second complication is pregnancy related. So you will end up with recurrent miscarriages, infertilities, and because the masses are in the uterus and they are compressing on each side, you can have malpresentation of the baby. Okay, and even you can have obstructed labor, especially when the masses or the fibroids are around the cervical region. They can actually occlude or they can block the cervix, and therefore you end up with um, um, obstructed labor during the time of delivery. The other thing is that these masses can undergo changes, what we call degenerative changes. Okay, so they can either be filled with some fluid, what we call cystic changes, or they can be filled with some salts and calcium, what we call calcification, so they can be calcified, or even they can be filled with some cartilage tissue, so they can undergo hyalinization, okay, and then they can also be friable, so they can become red, friable, and easily bleed, okay, and less than 1%, okay, has been proven to transform to cancerous. So basically, in essence, mostly they are benign tumors. So how do you make a diagnosis? Of course, history and physical examination. But number one, you do an ultrasound. The ultrasound should be able to give you that. Okay. So, and then you can also do MRI and also hysteroscopy, where you introduce a camera through the cervix all the way to the uterus to basically look at the uterus. Okay. Now, how do we manage? So number one management is we have the conservative management, we have the medical, and then we have the surgical management. For the conservative management, mostly especially it happens especially during pregnancy. So if someone is pregnant and they have myomas, most of the time we watchfully wait. Okay, so there is nothing much we can do until delivery. That's when we basically make a decision on how big they are, whether they will need to be removed. So that is number one. So watchful waiting. Okay. Number two is medical management. So with medical management, basically it can involve hormonal, okay, but also symptomatic management. With symptomatic management, you give painkillers because sometimes they are very painful. Okay, so you give painkillers, mostly NSAIDs. You give also tranexamic acid to help reduce the bleeding. And then you can also give some hormonal therapy, okay, like combined oral contraceptive. They help to shrink, okay, and other medication that help to shrink, like the gonadotropin releasing hormone agonists. And then surgical is where you go and remove them, especially for women who are within their reproductive age and they still want to give birth. You go ahead and remove them in the procedure called myomectomy. Okay. Now, for women who have already finished giving birth and they just want, they do not intend to give birth again, you can go ahead and remove the whole uterus, what we call hysterectomy. Okay, now for if you cannot do myomectomy and you cannot do hysterectomy, there are other procedures that can be done that can basically help to reduce that bleeding, and especially during menses, like uterine artery embolization. You can do radiofrequency ablation, but also you can do what we call MRI guided focus ultrasound. Okay, so by far that is what you need to know about uterine fibroids. Who are they at risk? What are some of the symptoms, and how do we manage? Now, if you are new here, please consider subscribing to our YouTube channel at Dr. on Wheels. Okay, or you can follow me on TikTok at Dr. Itsuma. You can also follow us on our social media platform at Zawadi Premier Hospital _Ngong, for our Facebook page, for our Instagram, and Zawadi Premier Hospital Ngong for our Facebook page. You can also visit us at our hospital. We are located at Loops Hill Center, that is at VET in Ngong, opposite Juango Petrol Station, and we will be able to help you. Until next time, God bless.